Hello everyone. In this video we will talk about the presumptive, probable and positive signs of pregnancy. Now the signs of pregnancy are divided into presumptive or probable or positive. Let's start with the presumptive signs first. The presumptive signs are the signs which are felt by a woman. So they are not the best indicator of a pregnancy, of a confirmed pregnancy. They are just signs which are felt by a woman and they are very non-specific. The first one is amenorrhea. Amenorrhea is obviously cessation of menstruation. So that's just a presumptive sign that is just felt by a woman. It can occur in many conditions. It doesn't necessarily have to be a pregnancy. The second sign are breast changes. Breast changes involve tenderness of the breasts or tingling or pigmentation of the nipples and areola. These are the breast changes that might be a presumptive sign of pregnancy. The next we can have morning sickness. The woman experiences nausea and vomiting in the morning time, and this is especially most pronounced in the first month and the first trimester, and it gradually settles by the third month. The next one is urinary disturbance. So the urinary disturbance is because of increased frequency of micturition, which is caused by the uterus exerting pressure on the bladder. So the growing uterus will exert pressure on the bladder, and that will cause an increased sensation of micturition multiple times in a day, which will lead to increased frequency of micturition. Next is quickening. Quickening is the first appearance of fetal movement, or the first time the pregnant woman perceives the fetal movements, and this usually happens from week 16 to 20. So these are the presumptive signs that we have: amenorrhea, the breast changes, morning sickness, urinary disturbance and quickening. Now if you look at the probable signs, they are more certain and they have a higher chance of being a pregnancy, but they're still not very indicative of a confirmed pregnancy. These signs will include enlargement of the abdomen of the woman, which usually happens after the 12th week. The second sign is Goodell's sign. Now Goodell's sign means that there will be a softening of the cervix, which is usually seen between 6 to 8 weeks. Next we have Hagar's sign. Now this is because of softening of the uterine isthmus. Goodell's sign was because of softening of the cervix. Hagar's sign is because of softening of the uterine isthmus. So in Hagar's sign we have to elicit it. So when we put our fingers in the anterior fornix of the vagina and in the abdomen, so one hand will be in the anterior fornix of the vagina, the other hand will be on the abdomen, we will perceive that both of these fingers are meeting each other, and that is because of the softening of the uterine isthmus that we feel that both of the fingers are approximating each other, and this is seen between 6 to 8th week. Next we have Braxton Hicks sign. Braxton Hicks contractions are painless uterine contractions. So these are not actually the contractions that lead to delivery. These are painless uterine contractions which the patient starts to perceive by 16th week, and they are felt on palpation. Next is ballottement. Ballotment is a sign where when we tap the cervix at the bottom, the fetus floats up, and then eventually we will feel that the fetus has sunk back downwards. This is because of the presence of fluid. Now it could be due to amniotic fluid, but it could also be due to ascites or a growth in the uterus like a fibroid. So this can't be a very certain sign of a pregnancy. The last is a pregnancy test, which is based on beta HCG levels in the urine. Now again, a pregnancy test doesn't have to necessarily indicate a confirmed pregnancy, because there's a lot of conditions in which the beta HCG levels might be positive. Now positive signs are definitive signs. These are definitely confirmative of a pregnancy. The first one is palpation of the fetal parts. Now once we are able to palpate the fetal parts, we can confirm that there is a positive pregnancy in the uterus, and this is mostly felt between the 20th to 22nd week. Next is fetal movements, which is also felt on palpation. Fetal heart sounds are auscultated using a stethoscope, and these can be auscultated between the 18th to 20th week, and these are a definitive sign of pregnancy. Presence of the fetal heart sounds definitely confirms a pregnancy. Next, we have radiological investigations like ultrasound. So ultrasonography, we can visualize the embryo, and in the embryo we can see the gestational sac by the 4th week and the fetal pole by the 7th week. Presence of both of these confirms a live viable intrauterine pregnancy. Finally, we have an X-ray. Now, X-ray is usually obviously not recommended because of exposure to radiation, but in case it's done, what we see is the fetal skeleton.